School outfitters created ideas for adapting infant and toddler rooms based on CDC guidelines and observations from childcare facilities that have already reopened. Let's see an example layout that demonstrates these ideas. Here is a room that we designed for young toddlers. Let's look at how each part of the room contributes to distancing and hygiene. Changing areas should effectively separate diapering from all other activities. Furnishing should be arranged to maximize efficiency and sanitation. For example, placing the changing table next to a sink makes it easier and faster to wash hands at all steps of the diapering process. Consider using a sink other than the restroom sink, so staff can immediately wash without walking into a different room. In toddler rooms, consider placing the changing table next to the restroom, so you can quickly deal with accidents when toilet training. You can reduce the chance of touching biohazards by having a waste receptacle that is only used by gloved employees when they are diapering. Cabinets above and underneath the changing tables save time and shrink the distance involved in discarding soiled materials. Cubbies can hold clean changes of children's clothes in case they become soiled during diapering or toilet training. Storage cabinets can hold a change of clothes for staff members who get soiled during diapering. Certain compartments can also hold tied-up bags of children's clothing. Low dividers let staff see children at all times. Smooth, soft divider surfaces wipe down easily. Lastly, consider placing your changing area as far away from feeding areas as possible. Feeding areas need to promote separation and cleanliness through preparation, eating, and cleanup. Consider individual feeding chairs that let staff space out toddlers and face them in the same direction. Consider arranging the feeding area around a sink that is only used for food preparation. A waste receptacle in the feeding area helps to contain germs from food waste. Low dividers let staff see children while keeping feeding activities separate from all other areas of the room. Activity areas should be designed to facilitate infant and toddler development while also encouraging individual activities and cleanliness. If you can have only one chair at each table, this sets an expectation for individual activity. For tabletops, chairs, and all other play items, consider smooth, non-porous materials that wipe up easily. Consider replacing tables that have peeling edge bands so germs won't find a convenient place to gather. Consider UV wands and UV storage so you can quickly sanitize items without using chemicals. Let staff readily find sanitizer stations and sanitizer carts so they can quickly clean hands and surfaces. Consider having containers in the room where staff can place used items that need to be cleaned before the next use. Consider bin storage that contain cleaned items ready for children to use. For personal storage, consider using every other locker to keep items from intermingling. Lastly, consider washable and antimicrobial rugs that slow the growth of germs on their surfaces. Infant and toddler rooms serve other functions where health and safety must be considered. Layout choices can promote clean restroom use. We talked about placing a changing table close to the restroom door so you can efficiently deal with accidents during toilet training and diapering. Also, hand sanitizer stands at the restroom door serve as a reminder to clean hands before touching the doorknob. Restroom procedures and supplies also promote clean restroom use. Have personal protective equipment like gloves and liners ready at restrooms and changing tables for staff to help with toilet training and diapering. In restrooms, paper towels can be individually used and discarded in waste receptacles with open tops or foot-operated lids. Lastly, consider policies for cleaning the restroom between uses, including consistent use of gloves and wiping down common touch points. For infant naps, consider crib features and options that promote separation and cleanliness. Maintaining a 3-foot space between cribs promotes distancing and lets caregivers get to sleeping infants. Clear dividers and clear crib panels guard against germs while letting caregivers easily see their nappers. For toddlers, consider napping arrangements and policies that reduce the chance of transmitting germs. For instance, head-to-foot napping arrangements increase the distance for respiratory particles to travel. Cot sheets can contain secretions. After napping, they can be immediately removed for laundering. Finally, consider policies for removing sheets, wiping down surfaces, and laundering after nap time. Now, let's look a little more closely at specific furniture and equipment that can help with your health and safety needs. When changing tables have shelves underneath, caregivers can more effectively get what they need and discard waste quickly. Toddler steps reduce the strain of getting growing children to the changing surface. Wall-mounted units further reduce strain by letting caregivers reach for supplies while fully standing. Disposable liners protect the table surface, and they let caregivers discard waste efficiently. Individual feeding tables space children out to reduce the chance of sharing germs from saliva or food particles. Smooth surfaces let caregivers easily wipe down tables and trays. Food carts reduce trips when items need to be transported from a food prep area to a feeding area. Low dividers section off the feeding area while letting caregivers see all children at all times. The smooth surfaces wipe down easily. In napping areas, clear panels on cribs let caregivers see their sleeping infants. The acrylic panel surfaces wipe down easily. Clear acrylic dividers can additionally hinder the spread of germs between cribs. On toddler cots, vinyl-coated fabric and plastic frames let caregivers easily clean up saliva or other secretions during nap time. Cot sheets can be easily removed and laundered before the next use. In activity areas, small tables promote distancing by encouraging individual activities. Laminates and plastics wipe down easily. Consider washable and antimicrobial rugs to keep these areas clean for tummy time or any other activity. Soft toys and equipment with vinyl coverings are easy for caregivers to clean. Personal protective equipment protect your staff when working with children throughout the day and when disinfecting after children leave. Masks help to reduce the transmission of respiratory particles when your staff are in close contact with infants and toddlers. Infants and toddlers should not wear masks so they can breathe properly. Face shields or masks can be worn to keep staff from breathing in any chemicals that are used when disinfecting after children leave. Goggles can also protect the eyes when staff are disinfecting items. Gloves need to be frequently changed during feeding, diapering, and cleaning. Infrared thermometers let staff take children's temperatures quickly without needing to expose the mouth. Storage can reduce germ transmission in a number of ways. Cubbies keep items separate. They can also hold changes of clothes when infants and toddlers spit up or have accidents during toilet training. Bins let you efficiently access and distribute items in the cubbies. They also serve as convenient storage for used items for later cleaning. Lockers keep personal belongings separate from other students' items. Cabinets let you keep cleaners and other supplies out of reach until staff access them. Sanitizing equipment and supplies must be readily available, and access needs to be regulated. Mobile sanitation carts can be wheeled wherever they are needed. Staff should access items and help children with any wiping or any sanitizer use. Portable sinks let people wash hands in activity areas without resorting to restroom sinks or sinks that are used to prepare meals. UV wands let staff sanitize items with the same shortwave radiation that hospitals have used for years to eliminate microorganisms from surfaces. We hope this video helps you as you consider how to adapt your infant and toddler rooms. If you want to talk through any ideas you have, please contact one of our consultants. We are happy to help. Thanks for watching.